If you're thinking of having a lip lift surgery, you're in luck because today you and I are going to explore the details of this procedure, which is a permanent surgical way to enhance, enlarge, and lift your upper lip. This procedure has been driven by social media, by Hollywood, and self-promotion by plastic surgeons. Today, we're going to go through each step of this procedure. We're going to decide what the goals of the procedure are, who the good candidates are, who the bad candidates are, and also through each detailed information about what the procedure is about, what to expect before surgery, during surgery, after surgery, and long-term what to expect as well. So please continue to watch. So first we have to define what your goals are in terms of the lip lift procedure itself. Some people want to look more sensual, and therefore exposing more of the pink area of the lip creates more sensuality of the upper lip. Also, the distance between the base of the nose and the vermilion border, which is right here, lengthens with time, and some people are actually born that way as well. So it's not just an age-dependent problem, but very often as we age, this area from this distance, I should say, from the base of your nose to the edge of your lip, it lengthens. And we want to shorten that because that's associated with a more youthful contour of the lip. In addition, we want to get a tooth exposure. As we smile, we want to see more of the upper palate exposed, and so that about 10 millimeters of the tooth is showing when we smile. Some people have a hidden smile, so to speak, and they want to get more enhancement of that area. In addition, there could be a downward drooping lateral portion of their lip, and that's also something of concern and is a goal to consider when we do a lip lift surgery. The other things that we have to think about, of course, is the ethnicity of the person, the age of the person, and whether or not they want a subtle improvement or whether they want a more exaggerated improvement. So all these things are taken into account when we consider what the goal of the procedure should achieve. Who is a good candidate? Who's a bad candidate? We're going to discuss that now because this is a big subject, actually, that has been glossed over as far as I'm concerned. I think way too many young women who have looked at some of their idols and want to emulate many of the people they see on social media have actually gone overboard in their desire to have enlarged lips and enhance their appearance based on their lip size. I think it's a mistake that many of them are making. I'm not saying that young people should not get lip enhancement with a lip lift. I think there are certain people, though, who actually are already starting out with large lips and they want them to be even larger. And why do I think this is a mistake? Is because 5 to 10 years hence, this trend, this rage that's going on for enlarged lips, this may change. And we have seen, as a plastic surgeon who's been in practice for many years, I've seen trends come and go. And this may be a trend that may fade with time, and enlarged lips may no longer be in style. So all of a sudden you're now choosing to do a permanent procedure that may end up not looking good when you're 40 or 50 years old. So you have to recognize that you have to make sure that the decision you're making is the right one. And that should be based upon a lot of thought and consideration. It's not age dependent because there are some young people who would be greatly enhanced by having enlarged lips, okay? Because their lips are thin or the distance from the base of their nose to their vermilion border is long. Those are good candidates to consider having a lip lift. There are some people who have what I call gummy smiles, and they have like a lot of show on their upper gums when they smile, and those patients are generally not good candidates for lip lift enhancement. Also, there are patients who have very large bites of their teeth, And they also are not good candidates because too much of their tooth show occurs after you enlarge and shorten the distance between your base of your nose and the lip line. So those two particular situations are not ideal to have a lip enhancement. The patient who is ideal to have a lip enhancement, of course, can be young or old and have this long distance from the base of their nose down to the lip line, or their corners of their lips may droop, and those are also good candidates, as I previously outlined. If you're considering having lip lift surgery, you have to prepare for the surgery in the following way. First, you have to stop all blood thinners because the surgery itself can be bloody, and therefore we want to minimize the bleeding during surgery, so we want to stop aspirin, Advil, Motrin, vitamin E, fish oil, omega-3 vitamins, and other drugs that can potentially thin your blood, because we want to minimize the amount of cautery that we use so that there is less scarring during the procedure. And that's very key because we don't want to end up with any significant scarring around the base of the nose or underneath the skin. In addition, I tell every patient to be on Valtrex, which is a drug to prevent cold sores of the lip, because even if you have no particular history of cold sores, sometimes this procedure can cause you to have an outbreak of herpes infections on the lip itself. It's kind of the trauma itself can precipitate that occurrence. And so those are the two things I want you to do. And also there's a third one, which is if you're a smoker or you vape, you can't smoke at least a week to 10 days prior to surgery and at least 2 weeks after surgery, because that will impair the procedure and because it constricts the blood vessels around the mouth and potentially could impair the outcome of the surgery. My recommendation, regardless of who you go to, is you don't eat or drink anything prior to the surgery, from midnight on prior to surgery, and we want you to come in relaxed. Sometimes I give patients Valium orally prior to the surgery, and then intraoperatively I also start an IV drip of Tylenol, which is a very good analgesic, as well as some IV antibiotics and steroids. For my patients, I have them lying down and I use a marking pen to mark from the outer aspect of the ala, which is this little structure here, just around the curvature of the ala and up across the base of the nose. I don't enter into the inner aspect of the nose itself because I don't want any distortion of that area. I want to keep the nose and the lip as separate cosmetic entities. And I go across the base of the nose to the opposite side, and I want to make a very symmetric mark, because that's ultimately going to be my guide when I make an incision. And then I measure the amount of tissue that I intend to remove. It may be from 4 to 6 millimeters in diameter. And again, I make the same mustache type of incision or markings. And then following that, I inject a little bit of Novocaine-like medication called lidocaine, which has epinephrine in it. And this epinephrine constricts the blood vessels, prevents some bleeding from occurring. And then I take a fine incisional knife and I make an incision along those pre-designated lines, and all that tissue is taken out in one piece. And it's not just the skin that's removed, it's also the subcutaneous tissue down to the muscle layer. The muscle layer is not violated, it's kept intact, and I do a little further little dissection, but I don't dissect down all the way to the lip line itself because it causes more swelling. After that, there's what's called layered closure. So layered closure, deep layered closure, takes the tension off the wound itself, and when I close the skin itself, I use interrupted sutures that are non-absorbable because it leaves fewer suture tracks later, and each suture is then removed in approximately 5 to 7 days following surgery. Now let's talk about how you're going to recover from a lip lift. Now, obviously, these are my recommendations. Your surgeon may have different ideas than mine, but I have specific ideas about what people should do after surgery. So one thing is, obviously, you're going to go home after surgery with a bandage under your nose that's taped up, and that tape and bandage is going to be removed the following day. You can shower if you'd like, and then afterwards your lip is going to be quite enlarged. It's going to be swollen. It's going to be red. I don't want you to be alarmed by that swelling. That swelling is normal, okay? And it may look distorted. It may look much larger than you anticipated, but it's something that you have to expect, okay? Because when you do surgery here, it disrupts some of the lymphatics, which drain away fluid, and it causes a lot of swelling around your mouth, and that's totally normal. That's going to be a totally normal outcome immediately following surgery. And of course, you may have some bruising, because anytime you make an incision around the lip, bruising is a possibility, because there may be a little bleeding from some capillaries around the lip. What do I do for my patients? My patients, I recommend that they take oral medications that include a Keflex, or if you're not allergic to penicillin, or you can take doxycycline as well. You can apply ointment to your lip sutures that are under your nose, obviously, or maybe in the corners of your mouth, and you apply them 4 times a day with a Q-tip. You can try to keep it clean. You can take a shower, as I said, the day after surgery, and then this goes on for approximately 4 days. After 4 days, then I have you come back to my office. Not everybody has that follow-up, but that's what my policy is, and I look to see that you don't have any infections. Infections are pretty rare. They may occur, but it's rare. So at that point, we'll decide whether or not you need any further antibiotics to cover you for any infection. By the way, I want you to continue to use the Valtrex, because I don't want any outbreaks of herpes simplex on your lips. So you continue that for at least 7 to 10 days as a total timetable for that. Now, you continue using ointment on a daily basis until I switch you over to Vaseline or Aquaphor on day 4. And I do that because some patients have contact dermatitis that they develop to bacitracin if it's used for a prolonged period of time. In addition, you're going to take oral steroids, because the oral steroids of a medrol dose pack will help to reduce some of the swelling that you're going to encounter following the surgery. I also encourage you not to eat any steaks or anything where there's exaggerated chewing movements of your mouth, and even talking and laughing and exaggerated movements of the mouth should be minimized for at least 10 days, believe it or not, because we don't want to distort the surgery in any way, and by opening and closing your mouth in a very exaggerated way, you can kind of loosen up the sutures, and we don't want that to happen, because we don't want any scarring to occur that is thick, and we want very fine incisions, and we want to optimize the final result. I also want you to avoid sun exposure. Okay, it's very critical that during this period of time when the wound is fresh, that you avoid sun exposure, because that's only going to highlight the incisional scars that may occur. So avoid sun. Apply sunscreen. And by the time the sutures come out, you can start applying sunscreen to the area. And I like to use titanium and zinc types of sunscreens, which I feel are the best ways to block the ultraviolet A and B rays of the sun. And you might have to wear a hat to, again, avoid sun exposure if you have to go out. By day 10, you should be applying a silicone gel to the incision, because no matter how good the surgeon is, and this is very thick skin over here, you're always going to have a little bit of a scar there, okay? We're going to try to minimize that scar by using silicone gel on a daily basis for weeks to months. For up to a year, you're going to need to use silicone gel several times a day. You can apply sunscreen over that gel, by the way, or makeup over that gel, but you got to put the gel on first because you want to reduce that scarring, and that silicone gel can help. Now, if it stays pink or red and stays like that for a prolonged period of time, then I step in and recommend to my patients that they have a pulse dye laser treatment, a laser resurfacing, a microneedling. There are other procedures, or sometimes injections of 5-FU or Kenalog can help to reduce the scarring. But when surgeons say, oh, you can't see the incision, I think they're blind, okay? Because yes, there can be an incision you can see. Hopefully, over time, it will not be that noticeable, particularly in older people, by the way, because older people don't have as vigorous a fibroblast reaction to incisions. Sometimes you can make a big incision on their forehead and you can close it, and then you don't see it after a while. Whereas you take the same type of incision in a young person, and this is another reason that young people should be a little cautious, is that incision on a young person can look hypertrophic, okay, thick and reactive, because their fibroblasts are pumped up and ready to heal, and therefore your incisional line may not look as good when you're young compared to when you're older, believe it or not. So there are many things we have to take into account, we have to think about prior to having a lip lift surgery. But I hope that this video has outlined for you and clarified for you what to expect, who the good candidates are, and how to proceed with caution. My objective is always to be a guardian for my patients. I'm not just trying to sell surgery to the patient. I'm trying to give them information that they can make an informed decision to whether or not they want to proceed with a particular procedure. And hopefully you have a surgeon who is honest and straightforward with you and can give you that kind of information. That's what you need to have so you can proceed and have a great outcome. I hope you found this video to be informative and helpful when you're considering having a lip lift procedure. If you have any further questions, please leave them below. I'm more than happy to answer the questions when I have time, and I look forward to seeing you again in my next video.